Hi, all. So, we are now going to talk about chapter 10, which is environmental health. So, in environmental health, we're going to explain the relationship between the environment and human health and disease, understand the key disciplines that inform nurses working in environmental health, apply the nursing process to the practice of environmental health, and describe legislative and regulatory policies that influence the impact of the environment on health and disease patterns in communities. We're also going to explain and compare the environmental health roles and skills for nurses practicing in public health, as well as those practicing in practice settings, and incorporate environmental principles into practice. So environmental factors. So what's important about environmental health, because I feel like those objectives can fly right over you, is that you're in your environment no matter what, right? Whether it's physical, chemical, biological, social, and psychosocial, and they're always going to affect the way you develop. Now, there's more obvious health issues when you think about like air quality, or do you work somewhere with a dangerous chemical? But don't forget that social and psychosocial make a huge impact on growth and development and achieving goals in terms of community health. So when we talk about race issues in this country, and it's kind of hard to grasp when people talk about, the psychosocial or a social environment of oppression and hate and all those things. But they are these underlying issues. If you've grown up with this idea that you're never going to be as good as another ethnicity or racial group, it affects the way you grow up. It affects the way you're parented if your parents believe those things. And that's where you keep getting these gaps and divide. So an estimated 24% of the global burden of disease and 23% of deaths can be attributed to these environmental factors. So environmental exposures that are kind of easy to grasp, we talk about herbicides, pesticides, other chemical carcinogens, lead, and radiation. I talked about, the lead issues with Flint, Michigan. We'll talk about radiation maybe after people who grow up by a nuclear power plant or a place of nuclear reaction or accident. Or we talk about how, what about as nurses? I'll tell you, in the ICU when I worked, my patients had several x-rays a day, and I wasn't wearing any lead during that time. Chemical carcinogens, whether it be found in our food or everyday products, or if you work somewhere where you're exposed to them. What about chemo agents if you hang chemo? Pesticides and herbicides. There's lots of study of the organic phosphate issues and respiratory disease for children who worked in farms. So environmental exposures. So Healthy People 2020, here are the environmental health objectives. So eliminate elevated lead blood levels in children. So this has been a problem that actually keeps increasing versus decreasing, even though lead blood levels have been part of pediatric practice for many decades. And it's getting worse too, especially with they found a lot of high lead concentration in toys from China, in water, and high lead blood levels are dangerous for both adults and children, but really in children for development. Minimize risks posed by hazardous sites, reduce significant pesticide exposure, reduce the amount of toxic pollutants, reduce indoor allergen levels. So one of the number one reason for admission or emergency visits in pediatrics is asthma related, and in adults as well. And it's not just from outdoor allergen like pollen, but indoor. So mold is a huge problem. And then decrease lead-based paint or related hazards. So historical context, we look at Florence Nightingale, who looked at the environment. She's one of the first, kind of environmental health people. And she looked at how clean water and sanitation affected outcomes in the war hospitals. Lillian Wald and the Henry Street neighborhood. So Lillian Wald Okay, so Lillian Mauld was educated in New York. Um, she lived with a wealthy family. She trained professionally as a nurse um, at the School of Nursing in New York City. After a year as a nurse in an orphan asylum, she spent another year studying in the women's medical college. And it was during this period that she went down to New York City's Lower East Side to volunteer as a teacher in home nursing for immigrant women. There was a little girl who took her from the classroom through the filthy smelling streets of this tenement hall where a family of 7 shared 2 rooms with boarders. And she found the little girl's mother was so sick and she was laying in like a dirty bed and hemorrhaging. She decided to live on the Lower East Side where there was overcrowding in tenement halls and lots of immigrants who came every year. And she realized that these people were working and living in these terrible environments. And she soon began to help with public health and environmental health. And she started training people in public health, specifically in nursing. And she revolved mainly around children and their interests. They had no place to play in the area of the Lower East Side. So she started a playground in New York City and made municipal parks. And she started studying mortality within these tenement halls. So she was kind of an epidemiologist as well. So she looked at environmental justice. Both Nightingale and Wald did extrapolation studies. And also in 2001, the CDC began monitoring what we call biomonitoring, so testing human fluids and tissues for potentially toxic chemicals. So we look at toxicology, epidemiology, geographic information system, and multidisciplinary approaches. One really interesting study was done in Camden, New Jersey, and this is where they got geographic information. They started looking at asthma ER visits and admission rates among adults and pediatrics in Camden, New Jersey, and based on zip codes, and then from their geocoding, they found that the percentage was from these 2 project housing, and they went in and did some toxicology and mold reports and found that both project houses were filled with mold. So they got a grant because they realized that fixing this mold problem was going to decrease overall healthcare costs to the county. And from there, they had a rapid decrease in asthma-related admissions and ER visits, which is quite cost-saving. So sometimes called the study of poison, toxicology looks at the rates of chemicals in bodies and the negative effects. Pollutants have multiple routes into our body, right? It could be absorbed through the skin, in the water or creams that we use, inhaled into our lungs, taken in orally. And then there's something called epigenetics, which is the changes that occur to our DNA that are hazardous. So, think about how radiation can actually change your DNA and cause cancer genes to turn on. Individuals have unique responses, and there are different chemical families that have different rates of effect on health. Oops. So epidemiology studies strength of association between exposures and health effects. It's used in all health, but very helpful in occupational environmental health. And there's the idea of the epidemiologic triangle, which is you need an agent, host, and an environment in order for this disease or problem to occur. And the agent can be an actual disease like bacteria or an exposure. The host is those who get hurt, and then the environment in which they live. But the thing about the triangle, it doesn't talk about temporality. So the amount of time of exposure or amount of time between the start of exposure to disease. So that's also important. And in more recent epidemiologic models, they discuss that. So we talked about geographic information using geocoding. And this helps, like I said, educate communities and local policies. And Hill and Butterfield's model of environmental risks is actually really helpful, and we can look at that in the next lecture.